Want to talk about pee in your pants?
Yep, let's talk about pee in your pants. So it has been brought to our attention.
No one likes to pee their pants.
No one does. I mean, except for kids when they're potty training. I don't think it.
Sometimes Asher just pees his pants now because it's fun.
That's so weird. Okay, so there's a lot of jumping in the metabolic workouts, and for some people, no matter if I empty my bladder before a workout, I still leak a lot. So I know Kegels help with this, but there are other things to work. Are there other things to work on to help with this, or modifications for some of the jumping exercises? This is kind of embarrassing, but I just know from being in there that I'm not the only woman dealing with this. Might be an uncomfortable conversation for Trevor. I just want to let you guys know there is no conversation that Trevor really gets uncomfortable with.
Nah, it's super uncomfortable. But like a reality, right? We have a lot of females that have had kids, have had pelvic issues, that probably have pelvic floor issues that aren't able to sufficiently close their sphincter.
That's a funny word.
Sphincter is kind of a funny
I just
word.
wanted, like, you guys were all worried about Trevor. Maybe it's me that we shouldn't have these conversations with. So,
all right.
Trevor
so what can we do about it?
But you mentioned pelvic floor. So, like, maybe we should talk about that and then kind of go from there. So, pelvic floor are the muscles in the lower abdominal region that help support and you're able to move and stabilize your pelvis, your bladder, all the little holes in the bottom.
Correct.
So, this goes a lot for women who have had abdominal surgery, any type of like carrying a child, and sometimes even people who have had severe back injuries will deal with a lot of issues here. So we naturally have an anterior tilt of our pelvis, so our pelvis kind of dumps forward. But what happens after you're carrying children or these situations, our pelvis kind of goes even further forward. So what happens is those abdominal muscles don't get used or contracted. It's a lot of times why people will say they have a lot of low back pain, or I have a really big butt, and they don't necessarily have a big butt. They just are really tilted, so it looks like their butt hits back further. So some of the stuff that we can do are
lots of different things. Positioning is probably the first and foremost. So like re-educating on what proper position looks like.
Do you want me to? Would it help if I like stand and?
I mean, if you're at home and want to play along.
I don't know
so
if
we
I
like
can
to think of
stand
the
and
pelvis as like a bowl of water, right? And so when the pelvis is in neutral, it'll be a little bit forward. Okay, a few degrees of anterior pelvic tilt is normal.
This is the front of my hip bones right here.
And so if we're excessively anterior tilted, it's going to stick the butt out, create a bigger curvature through the lumbar spine, and this puts those muscles at the bottom of the core at a disadvantage. It's kind of like straightening your arm out all the way and trying to contract your bicep. It's a whole lot easier when your arm is bent, when that arm is in like kind of the proper position.
So I literally have been in this position since you started talking about it, and my low back already hurts.
Right, so the low back muscles start to tighten up because they're kind of pulling up the back side of the pelvis, and then everything on the front side gets lengthened. The opposite of this is what we call a posterior pelvic tilt, what is actually what probably most people sit in all the time. Again, not somewhere where you want to be all the time.
Because these lower abdominal muscles will not be turned on.
The position isn't correct with the pelvis. And so we want to be a few degrees anterior tilted, but I like to just say, like, keep your bowl full of water. So if your bowl is full of water, that means that you're in a good neutral position. If your bowl is full, you should be able to engage your abdomen. You should also be able to engage your glutes. You should be able to stop yourself from peeing, which is kind of engaging that bottom pelvic floor area. And then it also allows the top side, which is our diaphragm, to be able to breathe from. So we should be able to expand in all directions. So anyone that we're trying to teach how to utilize their pelvic floor again, first we think about positioning. We actually wouldn't have someone work on positioning standing. We usually have them on the ground right away to start working on positioning, and then you need to be able to breathe from that position. And so if you ever can't breathe in a position, like, that's an issue. So we would typically have people on the ground working on that position because we can use the ground as feedback, and the ground is really safe for our bodies. So our body will allow us to do more things on the ground than it may allow us to do standing, because we just have more connection. And
you get external feedback.
Right. So we usually it's a positioning thing first. And then from there we start to work on strengthening the core. And then we also work on moving, keeping that position. So think about like just a basic hip raise. which super simple exercise. Everyone feels like they know how to do it. But when most people do a hip raise, they end up anterior tilting really hard to lift off the ground. And so they don't actually maintain what we call the canister at the gym. And so a true hip raise shouldn't have any change from your rib cage to your pelvis as you're lifting the hips off the ground.
It's really about driving the heels into the ground and using your glutes and your hamstrings, so your butt and the back of your legs, to lift you off the ground. So the key is when you're doing it is like your shoulder blades are going to stay stacked, but your ribs go. Sorry, you're starting to sound a little squeaky. Take another drink of tea. Yeah, so Jen said there is physical therapy at most facilities that is designed to assist with bladder training and strengthening. I'll read the rest of her comment. There are stimulation devices that can be used to help, laser therapy to assist with increasing collagen, and tissue assist with easier closure of sphincters. Estrogen application to periurethral area, etc. has, as well as exercise the staff is talking about. So there are other treatments that you can do with it, which, thanks, Jen, that was like super informative.
Yeah, I like it.
So
and so like if you wanted to try stuff at home, honestly, I'd probably have you working with someone is actually pretty important with this, because if you don't understand body awareness or what proper positioning is,
you're just training yourself into a continually terrible position.
Right, which isn't going to fix anything.
This is why you'll see a lot of people who come back to training after having a baby. We put them in semi-private training so we can retrain this position before they go over to team, because they struggle a lot with that positioning, and we do tons of that. Trevor also talked about like the progression. So along with starting from like the bottom of the hip raise position, we'll go to breathing with one leg, two leg up, and then also the bird dog positioning is another one.
So
where
bird
we just
dog is like
work
a quadruped 6-point position on the ground.
hands, knees, and toes, and you can literally work the positioning of being able to move your hips through the ranges, and we can load that as well with sandbags, so you can actually feel the movement going through.
Right. So kind of getting back to the question, it's a jumping thing typically for most people. So I'm jumping, I'm bouncing up and down, and that momentum and gravity creates a sloshing effect, which, you know, ends up making people pee their pants.
Well, one, you are probably, if you're drinking during your workout, it will happen more frequently. Like it just does. Like as you're drinking through your workout.
I have zero experience with this, so I can.
I mean, I don't.
Any personal
I haven't
anecdotes.
had children, and I have some pelvic floor stability, so I'm not 100% in the know here. I just have worked with clients that have this issue. So one of the things you can do is do some exercises, do a month of semi-privates, and get some help. Like really, that's what we're here for. That is one of our strong suits. And I mean, if you're doing team training, it's a $99 add-on for the month. Get 4 semi-privates, work on this, and then you can start doing stuff on your own.
It's things to think about when we're jumping is that pelvic position. If we're falling into like an anterior tilt when we're jumping, because now we're doing things, we're moving, we're losing that position, that can be enough to just not allow that sphincter to close all the way and put your muscles at a disadvantage. So playing with pelvis position, getting a little bit more abdominal engagement, trying to keep the pelvis full of water, and see if that changes things as well.
It can be a very minimal thing. So if we don't know you're having this issue during team training, like we can't help you out of it as well. So telling your coach, hey, I am having this issue. I know Jake might give you a funny face, but he does know what he's doing. He can help get you out of that position. So tell us. He might giggle. He's a boy and he's 20, in his 20s. Trevor might giggle too. So tell us so we can help support that position. And even some of the stuff that we do in all of the stuff we do in your warm up can be stuff that you use to practice this on to progress and make it stronger. So let us know, because without knowing, we can't actually give you some tips. 2, don't jump. If it's really that big of a problem, all of the exercises can be modified to non-jumping. Be it jumping jacks, you could exchange for full extensions if you would so choose. You could do jumping jacks with steps. So it'd be a lateral step in, lateral step on the other side. So they can be alternating. Just at the beginning of class, hey, can I get some non-jumping modifiers? And we'll just make sure we include them. Because sometimes we we feel like, oh, I know everyone in here can jump and they don't have issues, so we might not necessarily show those. So like just say, hey, can we get non-modified, like the non-jumping ones, and we'll talk about making sure that we start including those just as we go. Yoga has been, Erin messaged in, yoga has been doing a great job talking about pelvic floor and positioning. So yoga, Sunday nights, 6 p.m., functional fitness.
So many options. So many options.
So they like tons of things. And just if you're doing the workout and you want to continue jumping, working on that position, and whether you're sticking like your stomach out or you're like arched over, those are all positions you're not going to be able to keep a strong core positioning in.
And it's also having a little bit of engagement while you're jumping. Most people just kind of like, they're all loosey-goosey when they're jumping. They're just jumping. And so think about your positioning and then adding a little bit of rigidity to that positioning. So it's not like 100% abdominal engagement, like someone's going to punch me as hard as they can in the stomach, but I should be able to withstand like a whack to the stomach. Like if someone was going to just like tap my stomach, I should have enough engagement there where that wouldn't necessarily faze me. And so, you know, if I was coaching someone, the first place I would say is like, all right, let's fix your positioning, let's add some engagement, let's see if that changes anything. If that doesn't, then we can start moving down the corrective path, or even you need to go see a therapist for this and do 6-12 sessions and use all of the tools that they have access to, like biofeedback and that kind of thing, that we don't necessarily have access to here.
And sometimes people just being able to do it and breathe fixes the whole thing.
Right.
Sometimes holding your breath while you do this actually makes it worse.
Right, which would make sense because you're increasing intra-abdominal pressure.
So I think like making sure you're breathing when you're doing exercises is important too. So those are, I think we covered that.
I think that's good.
Okay.
All right.